want us to discuss on a topic, the prostate problems. A lot of men are passing through the challenge of prostate. A lot of men all over the world are passing through the problem of prostate. They don't really know the concept of prostate. They don't really know the signs and symptoms of prostate. They don't really know what they will do to prevent prostate problem. They don't really know the food they are eating that could trigger prostate problem. They don't really know the food they will eat that will help them with the prostate challenge. Now let us quickly look at what is prostate. A prostate is a small gland that is part of the male reproductive system. It is located below the bladder and in front of the rectum. The functions of prostate is to produce seminal fluids, a component of semen. That is the function. This fluid nourishes and transports sperm during ejaculation. That is the work of prostate. What it does is to produce the seminal fluid, which is a component of semen that nourishes and transports sperm during ejaculation. During ejaculation, the prostate contracts to help push the semen out of the urethra. That is the function of prostate. Now, with this problem, you can see that a lot of men are having this challenge. When there is problem within the urethra, that is when a man will be having prostate problem. Now, let us look at the signs and symptoms of prostate problem. Signs and symptoms of prostate problem. Number one is the one we call benign prostatic hyperplasia. The one we call benign prostatic hyperplasia, BPH. It's a prostate enlargement. It's common in older men and often leads to urinary symptoms. We have different signs. When you are having prostate enlargement, we have different signs. Number one is frequent urination. A need to urinate more often, especially at night. We call it nocturia. We have also the signs of when you are having prostate enlargement. It is still called benign prostatic hyperplasia, BPH. Prostate enlargement. When you are, what are the signs you'll be noticing for you to know that you have prostate enlargement? Number one is urge to urinate frequently, a sudden and strong urge to urinate. Number two is weak urine stream. You are finding it difficult to start urine. Number one is incomplete emptying. You are feeling that the bladder is not fully emptied. You feel like to urinate, but it's not coming out. The next one is dripping. You leak urine after urination. After urination, it is still leaking. The next one is straining to urinate. You force yourself to start up to urinate. You see how you are forcing yourself? You are trying to force yourself to see if you can urinate. That one is still sign of prostate enlargement. Number two is the one we call prostatic. Most of you that come to my office to run tests, at times when you have prostate, I'll tell you you are having what we call prostatic syndrome. That one is an inflammation of the prostate. The prostate is already inflamed, and it could be caused by infection. When you have infection, it could trigger that. What the signs you will notice when you have prostatic is number one, pain or discomfort when you are urinating. You feel pain in your pelvic area, lower back or genital region. The number two sign you will have is painful urination, a burning sensation or pain during urination. That's what you will notice. And you find it difficult to urinate. When you want to urinate, you will find it difficult to urinate. And also a painful ejaculation. You find it when you want to ejaculate, especially when you are with a woman, top of a woman, you want to ejaculate, it will be paining you. And the next one you will notice that sometimes you feel feverish, you feel chills and body ache. These are the signs you will notice. And the next one we have, the third one, is the one we call prostate cancer. A lot of men have these symptoms. Remember, I have talked about 3 signs and symptoms of prostate problem. I have talked about what we call prostatic problem. We call that one prostate enlargement. We have prostatic, and the last one, which is called prostate cancer. What are the symptoms of prostate cancer? One, you will see blood in your urine or semen. There is blood. You will see blood in your urine. Another sign of prostate cancer is erectile dysfunction. You find it difficult to achieve erection. The next one is pain in the pelvic or lower back. You find it persistent pain. There's no persistent pain you have in your pelvic area, hip or lower back. The next one is you find it, you notice that you are losing weight. You'll be losing weight. That's another sign of prostate cancer. And then you have bone problem. You have bone. You be pain in your bones, particularly in your hip, in your spine, and in your upper legs. These are the signs you will have. And we also have general symptoms if you're having prostate problem. There is another one we call urinary retention. You find it difficult to retain urine, and you have urinary tract infection. Once the prostate is enlarged or inflamed, it could lead to, it's an infection. Infection could cause it too, which will make you find it difficult to empty your bladder. So when you notice this, it's time. These are the signs you notice. It's time for you to go to your doctor, to go and run tests, to check whether you are having all these things. And if you come to me, if you consult me, there is a medicine we have. We call it Prostate. It's for people suffering from prostate problem. Prostate. I will give it to you. You take it 2 morning, 2 night. So always contact me. My WhatsApp number, my phone number is there. So try and get to me. I will help you. Thank you for listening to me. I'll see your friend Kina Good. Stay tuned as I'm going to tell you more about the prevention of prostate. I'm going to tell you the management of prostate, the foods that could trigger prostate, and the food that will suit the prostate. Stay tuned. Thank you.